It's HIMSS 2019 right here from Orlando as we welcome you into CommonWell TV. Scott Adams here with you as we introduce you to some of our CommonWell Health Alliance members. It's time now to hear from Brightree and their CEO, Matt Mellott. And Matt, why is interoperability about more than just technical specifications and integrations?
Sure. I'd say very simply, it's about patient care. The technical capabilities and the integration are part of the how on how treating providers exchange data. Brightree customers need access to patient identity management tools, need access to record locator services, and interfaces also that help them manage around all these point-to-point connections. And so that's why Brightree is actually very excited to be part of CommonWell, because we get to leverage that technology for our customers to help improve patient care.
How does being part of CommonWell help with post-acute care delivery?
Sure. I'd say the cause we're trying to further there is visibility into care when a patient is in post-acute care. Too many times I think physicians are frustrated by they discharge a patient in post-acute care and they lose the visibility of what's actually happening there. And we all know for them to treat effectively, they need the data on that patient. Especially as we get into more value-based care models, they're actually taking on financial risk as well. So basically, our partnership with CommonWell, we're able to provide and leverage interoperability for visibility into the care in that care setting.
What limits CommonWell networks when critical mass hits?
I'd say one that we probably need to keep an eye out for is as these networks expand, the amount of data available to these referring providers is going to be incredible. So we probably want to make sure it's always consumable and that they can access it in their native workflows. I'd say is the primary one. Beyond that, I'd say we're talking about the limitation of the imagination of the participants and what can we leverage this network to do even more.
So how is Brightree then making an impact with that?
Sure. One of the things we definitely do is we're trying to be a voice for the post-acute care world, where I'd say historically they haven't had one, making sure we're an advocate that their needs are met and that they have access to these tools. And Brightree, we're delivering solutions that basically allow them to tap into the type of tools available through CommonWell.
How are post-acute providers really benefiting from the CommonWell connection?
Sure. I can't stress enough how important it is for a post-acute provider to get the data and the medical records they need before they start care. Okay. The amount of time wasted on capturing paperwork and going back and forth with the referring provider is tremendous. I'll give you a simple example about a typical Brightree home health customer. They get a referral for a patient, and to start that plan of care, they need all that information from the referring provider so that they can do an effective plan of care. In addition, they need it quickly so they can start that care as soon as possible. And finally, you need all that data to support their clinical assessments, facilitate billing, and make sure they get paid for the care they've delivered.
What are maybe some things that you would tell a provider that's attending HIMSS and as to why maybe they should get on board with the CommonWell Alliance?
I'd say definitely for referring providers, truly understand what CommonWell can offer, because two things will come from that. One would be, your data will be available for that post-acute care provider to use and effectively treat the patient. And then as I mentioned before, what they get in return is visibility into that care, so they can really see how that patient is progressing through care in that setting.
Brightree, really making a difference within our CommonWell Health Alliance community. And for more on Brightree, we welcome you to jump on to our website, commonwellalliance.org. Thanks so much, Matt.
Thank you.